after the first protocol is that I can control my bladder, and now I have no more little leaks. I'm down to my last week, and I have to say thank you. Do you suffer from interstitial cystitis? Have you been diagnosed with an overactive bladder or incontinence? Or do you have chronic urinary tract infections that just don't seem to be relieved by taking antibiotics and anti-inflammatories? Or even with the overactive bladder or with the interstitial cystitis or with incontinence, have medications that worked, whether they're over-the-counter or prescription medications? My name is Dr. Lonnie Herman, and in this very brief video, I'm sharing with you an email I received from a woman who's about 60 or 61 years of age, who had chronic urinary tract infection since she was 17 years of age, yet she was diagnosed in May of 2017, and I'm making this video on October 6th of 2017. In May of 2017, she was diagnosed with interstitial cystitis. She was having leaking from her bladder and burning, constant burning, and discomfort down in her bladder, lower abdomen area. And this all started after she had a certain heart valve procedure. All of a sudden, after the heart valve procedure, she started having the intense daily burning and the leaking from her bladder. You can get well. You can, with the right work, which I offer you, and again, I didn't tell you yet, but on my YouTube channel, which I'll put some links in this video and underneath this video, there are other videos where I'm describing the depth of a diagnosis or discovery or pinpointing the hidden infections and toxins that are causing these different overactive bladder or interstitial cystitis or incontinence conditions, which according to ultrasounds and cystoscopies and other types of tests that are run, or even urinary tract infections, in many cases, the women who I help, and even some men who I help with this condition, they just don't get relief, or they don't, I should say, they don't get a discovery. The doctor is not able to tell them why it's happening to them, so they just keep on medicating them and not getting the relief that the patient desires. So I'm going to read to you an email that this patient had sent to me recently, about 2 or 3 weeks ago. I'm going to read to you what she said, and there's 2 different emails here that I'm going to read to you. She's also going to be making a video with me when she's 100% relieved. She's happy to share this experience with other people out there, as I am with you as well. Also, I just want to state this ahead of time before I read this email to you, that 2 things. One, I'm writing a series of books, and one of them is, which I'm working on right now, is about the overactive bladder, interstitial cystitis, incontinence condition, whether it's one or all the above of those 3 that I just mentioned. So look for that in the coming months. Also, when I read this email off to you, which you're going to see, I'm going to take the email and just cover the screen, so you won't be watching me. You'll be able to read the email, 2 of these emails right on the screen for the remainder of this video. If it's going too fast for you, pause the video and read it yourself, and then just hit play again, so I'll be reading it off to you, okay? So let's switch over to this email and hear what she has to say. She said, in May of 2017, I began experiencing symptoms of my bladder burning before and after urinating. I also experienced frequency every 2 hours going to the bathroom. She was taking an over-the-counter medication, bladder ease, Cantheris. She drank soda and water, trying to help herself, as well as an interstitial cystitis diet. I began taking the remedies from me, Dr. Herman, August 8th, and stopped everything else. She stopped having the burning, still had some frequency, day by day getting better. The urgency became less, and to date, she no longer experiences urgency, is what she says there. Excellent, incredible, and I expect that. She says, I've had a few days that experienced some burning. However, the pain was very different than prior to taking the remedies. The burning was not as excruciating, and only for 30 minutes got the burning instead of 4 to 5 hours that she had the burning. Minor compared to major before. She goes on to say that prior to taking the remedies, I was extremely tired every day and woke up in the morning tired. Gradually, I noticed an improvement, and to date, I am not feeling tired in the morning or throughout the day. Awesome. Thank you very much for helping me rid my body from infections. Next email. The biggest surprise for me throughout this first protocol was when I started to feel a little burn and thought, oh no, but much to my surprise, the pain did not last very long, and it was much more mild. I was so excited. I knew that I was getting better because the pain did not cause agony for hours, basically is what she says. Another positive for me after the first protocol is that I can control my bladder, and now I have no more little leaks. I'm down to my last week, and I have to say thank you so much. And she also says, P.S., I've made a believer out of my husband. He didn't want to believe that I could help because all the doctors in the hospitals could not help her. You can get better. You can have relief. You can control your bladder. Even if your doctor tells you that it can't be done, I have a very unique system. Watch my other videos. I look forward to helping you. You can get well. I know this video was pretty quick reading through email. If you want to, stop, rewind, play it again, pause it, read that email. This is reality. Many women who are coming to me from all over the country and around the world, literally. I have people coming into my clinic in the US from Thailand, from New Zealand, from Italy, from different countries, Canada and other parts of the US, from Mexico, coming into my clinic to get help and get relief from their chronic bladder condition, amongst many other conditions that I help. I look forward to helping you. Contact my clinic at 954-370-3100 or send an email to my assistant at the email that I'll put up here on the screen, and I look forward to helping you, and you can get better.